Hello everyone, welcome to my YouTube channel. So today we're going to be looking at something I think I want to explain more. So we're going to be looking at low platelet count. Low platelet count. So we want to look at how to respond to questions in a case of low platelet count. But before we continue, my name is Dr. Emmanuel Obodo. I'm a biomedical scientist. I'm also a lecturer in biomedical science here in the United Kingdom. So yes, let's go into this. I've already made a video on platelet count, but I think I should differentiate it when we talk about low platelets and also, of course, high platelet count. And I also thought that I should give us more extensive explanation about it. So let's get into this. First of all, our outline for today, we are going to be looking at a few things, which include, we're going to look at platelets. What exactly is platelet? And then we're going to look at platelet count, because then if we know what is platelet, we can then know what platelet count means, okay? Because there's a reason why the question is on platelet count and not on platelets, if that makes sense. So now we are going to also look at the factors that influences platelet count, and this is where most of the questions comes. Okay, so most of the questions will always going to come in terms of maybe in a case of low platelet count, what do you think as the case may be, okay? Now, we're also going to look at what to do in a case of low platelet count. So if we know the factors that can affect it, then it can help us to know what to do when we suspect any of those factors. So by the end of this session, I hope we should be able to explain how to respond in a case of low platelet count. If you are working in the lab and you see a low platelet count, how do you respond? Remember what I said before on my previous video, that biomedical scientist is a clinical profession, and when you are approaching their answers, you need to approach it from the practical point of view. So how do you respond in a case of low platelet count? And I will also try to provide us reasons, scientific reasons behind any of the answers that I'm going to be providing to us, okay? So now let's get into this. First of all, what exactly is platelet? So when we talk about platelet, you need to know that, of course, another name for platelet is thrombocyte. And because of the word cyte, it means is a cell. Remember that I've said this many times on my previous video, that when you talk about a whole blood, when you talk about blood as a whole, you are looking at the liquid part of the blood, which has to do with plasma or serum. And then you look at the cell part of the blood, which has to do with red blood cell, white blood cells, and platelet count or thrombocyte. Okay. Now, so thrombocyte or platelet is one of the blood cells. So it's one of the blood cells, and one of its primary function is that once there is a kind of trauma or a kind of injury, okay, that injury, once it results to bleeding, what this platelet will do is to go to that site of injury and form aggregate in a way of their attempt to stop that bleeding from happening, okay? So in other words, they can help for hemostasis. They help to make sure there's no excessive loss of blood where possible. So platelets in generally help in blood clotting. Now, if we know that platelets help in blood clotting, what it then means is that we need the platelet to be normal in the system. So what it means is that if the platelets are not normal in the system, if they count, the number of the platelets, if it is not normal in the system, it means that platelets cannot be able to carry out this function of maintaining hemostasis or stopping blood loss or bleeding, as the case may be. So that is why platelet count comes in. So we measure platelet, we count platelets in the lab to give us confidence that the patient sample has got enough platelets in a case of bleeding, so it can give us enough information of what is going on in that patient. So it can suggest to us where possible whether the person have got a certain condition condition. It can also suggest to us if there is a bleeding. It can suggest a lot of things. But anyway, we do the platelet counts to help us to know the functional activity of the person's platelet, okay? And then if we think it is abnormally low or abnormally high, but on this occasion we're looking at low. So if we think it's abnormally low, we then need to consider factors that could make that patient to have a low platelet count. I hope that makes sense. So if platelet is important in blood clotting, it means that we need adequate platelet in every human being, in the system of that patient, so that once there's a bleeding or such a situation, the platelet can be mobilized to be able to control that. Okay. Now the thing is that if we're going to look at the platelet count, what it then means that there is a method of measurement. So I had already made a video on the primary principle of hematological analyzer. Okay, what it means is that if you take a whole blood which you collect from the EDTA and then you want to do full blood count, in that full blood count that you want to do, one of the things you are going to analyze is platelet count. So how would they be measured? So it's going to be measured, using maybe automated analyzer, except if you are doing a manual techniques in your lab, okay? Now, but if you are using automated analyzer, what I had mentioned is that this analyzer, they function by a number of principles. But one of the key thing about this one now, about platelet, is that, of course, I had mentioned previously about flow cytometry, impedance. I've mentioned something like aperture. But what I want you to know is that platelet has got a size, is a cell. And as a cell, under normal condition, it has a particular size. And it has a lot of features, like it is granulated cell, so it has granules. So what it then means is this: when the analyzer aspirates the whole blood, okay, so it will move some of the blood, will then go to the channel that can analyze the platelet. So once that the whole blood is lysed and expose the platelet or thrombocyte, now at some point this cell will then need to pass through that a hole which is called aperture, and as it passes through the aperture, that is how the analyzer can be able to count the amount of the platelet. Remember, it is not just only platelets. Through the apertures, white cells can pass, red blood cell can pass, and of course platelets will also pass. Anyway, as the platelet is passing, based on the size, the normal size of the platelet, that is how the analyzer can be able to measure the amount of the platelet in that very sample. So as the platelet continues to pass, it will continue to count it. So that is how that can be measured. And of course, I've already mentioned, that there are different reagents associated with that. So you can watch my video maybe analyzer reagent principle on 6 months. Maybe that can give you more detailed information. But what I want to say is that the method of measurement has to do with the cell passing through the aperture. So as it's passing through the aperture, the analyzer can be able to count the amount of the platelet count. I hope that makes sense, okay? Because this is important, because when we start mentioning about some certain condition, you will now see that analyzer will be unable to count it because of any of these conditions we are going to mention in future, okay? Now let us look at the factors that affect platelet count. What are the factors that can affect platelet count? So if we know that these platelet counts are important and they can be measured, so what exactly can affect it? Okay, now number one thing you are going to see that is likely to affect platelet count has to do with pre-analytical. So what may affect it could be from the pre-analytical. That means from the time the sample was collected before it's been analyzed. Okay, so the processes that took place, how it is collected, was it properly mixed, is it underfilled, and so on. So it could be pre-analytical. So pre-analytical activities can affect platelet count. And another thing then, of course, has to be the analytical. So what happens once that sample is analyzed, there can be some certain kind of result that again would affect the platelet count. Now, obviously, the last one then would then have to be the post-analytical, which you can see as a patient condition. So when you look at maybe someone has been to the lab and following the previous diagnosis, and that can explain why that patient has low platelet count. So these are the three main ways that you may need to group the factors that can affect platelet count in the laboratory. Okay. So now we're going to look at the pre-analytical. So what exactly happens Because when sample is, there are a lot of activities that takes place. There are a lot of activities that take place before sample can actually be analyzed. So we're going to look at how pre-analytical activities can lead to low platelet count. Now, what you have to do first, when you see a low platelet count result in the laboratory, you check the sample for a clot. So you check the sample for a clot. Now, if you check the sample for a clot, if it is clotted, obviously, it will explain the result. Why? Because the platelet count, that the analyzer was supposed to be counting has been used to clot the sample. And if it has been used to clot the sample, that can now explain why there's no much platelets, in that very sample. Okay, so that is why once you detect, if you check it for a clot and the sample is clotted, what it means that obviously you then need to reject that sample and ask for a repeat. But now let us look at this situation where you have checked the sample, and if the sample is not clotted, there's no clot in the sample, what are you going to do? So if you check the sample is not clotted, what are you going to do? Now, I want you to think about this, because you need to know that analyzer itself, is just an automated method. Okay, it's a mechanical method. It's not a human being. Okay, so sometimes there can be some certain kind of factors that may make the analyzer to give a false, low platelet count. One of those things something has to do with, when the sample is not properly mixed. So if the sample is not properly mixed, what is then going to happen then is that the analyzer may not be able to aspirate, a homogeneous sample that can give an actual platelet count. Okay, does that make sense? So what you then need to do is to rerun the sample. So why are you rerunning the sample? You are rerunning the sample to be able to verify correct aspiration the first time. So when the analyzer aspirates the sample, like I've said, it may not have mixed the sample very well, meaning that the sample is not homogeneously mixed very well. And if the sample is not homogeneously mixed very well, it means that when the analyzer aspirates the sample, it may be aspirating the sample in such a way, due to that lack of homogeneous mixing of the whole blood, okay, and also aspirating the required volume can affect that very platelet count. So that's why what you then do is to mix the sample very well, and when you mix it very well, then you can now put it back in the analyzer and rerun the test. So you are rerunning it so that you can be able to actually confirm that the analyzer has taken enough volume the first time. Okay, now what if it is clotted? So if it is clotted, obviously what you then have to do is that you've got to, of course, reject the sample, remove the result, and phone the ward and ask them for a repeat. Okay, now if you notice that the sample is clotted, what you are going to do is to remove the result, delete the result, because that result is no longer valid. So you've got to delete it. Once you delete it, what the next thing you might need to then do, obviously, is to call the ward. Okay, call the ward, where the sample is coming from. If it is coming from the GP, of course, you also call them and let them know that the sample is clotted and ask them to repeat that very sample. I hope that makes sense. Now, still on the pre-analytical, let us look at other factors as well that could lead to low platelet count. Okay, now it could be due to insufficient or underfilled sample. Remember that the EDTA has got a required volume of the sample that should be collected into the container. And what it means that if there are insufficient sample, if the sample is insufficient or it is underfilled, maybe there is a small volume of blood, that can obviously affect the aspiration of the analyzer, okay, and of course affect the platelet count. Okay, now another thing could be due to diluted sample. When you now notice that the sample is diluted, that diluted sample obviously means that the platelet count will also be affected. So this also can affect platelet count result. Now, what do you do if any of the above is suspected? When you suspect any of these above, whether it is clotted, whether it is insufficient, whether it is diluted, in any form of any of these above, if you suspect it, what exactly are you going to do? Now, I put this forward because when you go for your interview and you create a problem, you need to also provide the answer. So when you create a problem of, during your answers, you also need to provide answer of that problem you have created. For example, if you say that the sample is clotted, you need to give example of what you are going to do when you suspect a clotted sample. That way, you have provided solution of that very problem. Okay. Now, let us look at what you are going to do. One of the things you are going to do, like I've said before, is that you phone the ward and explain to them, this is what happened, this is what happened. I will need that sample to be repeated as the case may be. Okay. Now, the next thing you do, you ask for a repeat. Okay. You ask for a repeat, you phone the ward and you ask for a repeat. And of course, you can advise them where appropriate. For example, when the phlebotomy collect the sample, or the nurse or maybe the doctor, they may collect the sample, and maybe because they are busy, they failed to mix it properly. You might give them advice and say, please, when you collect the sample, try and mix it very well. Or you can say, try and take this amount of the volume to make sure that the sample will be sufficient. So you give advice where appropriate. Okay. So these are the things you can do when you suspect any of the above factors affecting the overall platelet count. I hope this is making sense. Yeah. Now let us look at the analytical phase. What and what can then lead to low platelet count from the analytical point of view? So now, number one, it could be due to platelet clumping. Now, because this is important, if you now know what I've explained previously about the platelet count passing through the aperture, okay, what it means that each of the cells need to be passing. So as it passes, the analyzer will be counting. So, but where there's a platelet clump, maybe there's a bunch of platelets clumping together. That clump will make it difficult for analyzer to be able to count the actual platelet count. By the way, because they bunch together, the analyzer may not be able, because that bunching of together then means that the analyzer may not be able to know is a platelet count. Even if it knows is a platelet count, it may not be able to give you the actual platelet count because it cannot be able to count each of the individual platelet because of that clumping together. That because of they've aggregated and bunched up together. That way the analyzer may not be able to count it. And if it does try to, in some cases, depending on how they clump together, it may mistake it for another type of cell, or maybe doesn't know what the cell means and may not even count the platelet at all. So that is why platelet clumping can cause low platelet count. And another thing is what we call platelet syncretism. In platelet syncretism, what it means that is a condition where the neutrophils is a subtype of white blood cells. So remember, I still mentioned apertures. So through the apertures, neutrophils can pass, lymphocytes can pass, all these white cells and red blood cells can pass through. That is how the analyzer can be able to count. This is the amount of the red cells or white cells or platelet, as the case may be. But in platelet syncretism, what happened is that you will see the platelet count, surrounding the surface, the membrane of the neutrophils. And I'm going to show you the picture. So once the platelet count, platelets surround the membrane or the side of the neutrophils, what is going to happen as the neutrophils pass through the aperture, the platelet count will also pass through that aperture, and that way the analyzer will be unable to count that platelet count because it's going through the aperture with the neutrophils. I hope that makes sense. Okay, so that can give a false low platelet count result. Now, it could be due to large platelet or what we call giant platelet. So platelet count has got its normal size. So if the size of the platelet become larger than required, okay, what it means that the analyzer may not be able to count it as platelet because the analyzer is programmed to know this is the exact size of the platelet. So, and once platelet count is large, the analyzer may not be able to count it because what it means that size of that platelet, has not been validated in that analyzer. I hope that makes sense. Although some of the analyzer might start giving you a suggestion once you start noticing that abnormal sizes and say suspect giant platelets or large platelets, as the case may be. But anyway, large platelet means that as the cell passes through the aperture, the analyzer may not be able to detect or measure it or count it as platelet because it might think it's not platelet because the size is bigger than the actual normal platelet count. I hope that makes sense. Now, you can also have what we call hypo-granulated platelets. Platelets are granulated cells, okay? So what happens that if the granules, if there is hypogranules, that means the cells are not, granulated the way it should. The analyzer could also mistake it and may not count it as platelet, and that way it can also lead to low platelet count. So hypogranulated platelets can also result to low platelet count. Now you have blast cells. Maybe in a case of leukemia, what happened here is that if there is a suspected leukemia, where of course the bone marrow now has been affected, obviously it can affect platelet count. But what I really want to say here in most cases is that maybe the patient is on chemotherapy, and that chemotherapy may also attack the platelet count, because the chemo attack blood cells, obviously including platelets, and that again will not lead to low platelet count. So these are the things you are going to see under analytical. So you look at it under the blood film morphology. You have to look at it from the blood film. So when you see any of this from the blood film, it cannot help you to start suggesting why that platelet count is low. I hope that makes sense. So blood cells is also another reason. Then you can have fragmented red blood cells. So when you see fragmented red blood cells in a blood film, it can be a strong indication of hemolysis, meaning that the low platelet count you are seeing could be due to bleeding, or maybe it could be due to a loss of blood due to hemolysis, as the case may be. So fragmented red cells is also another indication that you can see in the blood film that can confirm why the patient is having a low platelet count. Okay. Now you have in a case of malaria. So when you have in a case of malaria parasite, or even other infectious organism like virus, bacteria, can attack platelet, can affect platelet count. So what you have to do in a case of suspected malaria, you might need to check where has the patient been. So has the patient traveled to a country where there's a predominant of parasites, malaria parasites, that way that can start giving you an indication, or maybe the possibility of the person being infected with malaria. And of course you check it under the blood film. If you see malaria on the blood film, it will also be good to measure malaria rapid diagnostic test, which is RUDT. So once you do that, it can now help you to confirm that this patient has got has got malaria parasite, and that of course have now explained why the patient has got low platelet count. I hope this is making sense. Yeah. Now, another thing you might need to do as well in an analytical way, once you've noticed a low platelet count, you've checked your pre-analytical, there's no problem. You can also confirm any of these very things that we've mentioned, especially maybe in the case of bleeding, as the case may be. So you might look at, coagulation results. So you can look at the fibrinogen, you can look at D-dimer. So this can give you a strong indication. Even PTR and APT can give you a strong indication of the fact that this is a condition that have led to that low platelet count, or this is why there's a low platelet count. For example, low fibrinogen could suggest that the sample is clotted. It could also suggest that the person may be bleeding, as the case may be. And of course, when you see raised D-dimer, it obviously may suggest to you that there is a clot in that very sample. So these are the things that can suggest to you, or the person has got a condition that lead to internal clot, and that way will affect the platelet count result. So you can check coagulation as a confirmation of maybe why that patient has got low platelet count. So for example, like I've said, you can see low fibrinogen and you can see raised D-dimer. So these things can suggest why the patient has got low platelet count. Now let's look at the blood film morphology in this. So I'll be giving you some examples just to show you the things I've already mentioned, so that can give you a picture of how these things work. So number one, you can see that this is a platelet. So these platelets have now aggregated together, and this is what I mean by clumping. So when they aggregate together like this, analyzer will be unable to be able to measure the actual platelet count. So that's how platelet clumping can cause that problem. Now, I also mentioned about platelet syncretism. So this is what I mean by platelet syncretism. You can see that these are neutrophils, and on the side of these neutrophils, you can see the platelets. So these are the platelets surrounding surrounding these neutrophils. And due to this surrounding, what it then means that when these very neutrophils passing through the aperture, this platelet will also will pass through that aperture without being counted, and that can lead to low platelet count. Now, another thing I'm going to show you, which is the final thing, is the large platelet. So you can see that this platelet is larger compared with this platelet you are seeing here. So the sizes here are like the actual normal size of the platelet, but when they become larger like this, the analyzer may not be able to count it as platelet, because that is misleading. It may not know that this is platelet and may not count it. So these are some of the examples of what you can see in the case of blood film morphology. Remember, I mentioned other things that when you see them, of course, like in the case of fragmented red cells, it can also, or maybe blood cells, it can also suggest to you why the patient may have a low platelet count. But I thought I should show you this as it is specific to platelet. I hope that makes sense. So when you go for your interview, include platelet athleticism, include large platelets, include platelet clumping in your answer of the factors that could affect, that could lead to low platelet count. Now let's look at the action that should be taken. So once you notice there's a low platelet count in any of these any of these factors that I've already mentioned, what exactly are you going to do? I've already said you phone the ward and let them know. And when you phone the ward and let them know, where appropriate, okay, you might be phoning the ward to say this, okay, this person have a low platelet count, or maybe can I ask for a repeat? Any of those things. Let's say in the case of maybe platelet clumping, you can also phone the ward and obviously tell them maybe to repeat it and send you a situated sample, which I'm going to be showing you. So, or if you have checked any of these things and it's still normal condition, or maybe you've seen a blood cells, you also have to phone the ward. So what I mean is that depending on the outcome, where appropriate, you've got to phone the ward and explain the result you've obtained. That way you can allow the clinicians to be able to prepare for that patient. Okay. Now, what it then mean that when you phone them, depending on what you are, following the conversation you have with them, whether it is a nurse or the doctor or anybody in the ward, you need to document that very comment of that very conversation on the phone logs, or you can also put it on the laboratory information management system, which is LIMS. Okay, so that way when somebody look at it, the person can see that you actually phoned that result, because it is important, okay, that you phone a result that you think may be critical, especially when it comes to managing that patient. Now, another thing is you remove the platelet count where appropriate. For example, if you think it is due to large platelet or platelet clumping or platelet athleticism, or even anything as the case may be, one of the things you then have to do is to remove that platelet, because it means that the count you are seeing, the count the analyzer is giving, it is not the actual platelet count, and that is why you need to remove the platelet count. Okay, so if you suspect any of these things, okay, where appropriate, you remove that platelet count and then do the platelet count manually. And when you do when you look at under the blood film, from what you can see from the blood film, you can then put a comment saying whether the platelet count is adequate or whether it is not adequate. So from that way, you can put some comment of what you can see from the blood film morphology, but you need to remove that analyzer platelet count, because that can be misleading. Okay. Now, and this is where you then need to put a film comment, like I've said. So you can say platelet athleticism seen, or large platelet, or platelet clumping. Then you can put some comments suggesting this is why this patient has got a low platelet count. Then you can now put a general comment of suggesting whether the platelet count is normal or it is not normal, as the case may be. So, but what I'm trying to say is you need to remove that platelet count if you think that what you are seeing on the blood film morphology has affected the platelet count result. Okay. Now, you now request for a repeat of the sample where possible. For example, in a case of platelet clumping, you can ask for a repeat and ask them to send you a situated sample, along with the EDTA. So you can now run this EDTA and also run the situated sample, and at the end, you can take the platelet count from the situated sample. This is because situated sample or citrate sample has been, can help to prevent, platelet clumping where possible. Okay, so that is why it is important. So you can ask for citrate sample and you run full blood count on the citrate sample, run full blood count on the EDTA, but you take the whole parameters on the EDTA apart from the platelet. But the platelet count on the citrate is now what you're going to use to replace that of the EDTA. That is another way you can do it, when you ask them for a repeat to send you citrate sample as well. You also ask for a repeat if you have checked everything and everything seems to be okay, even though the person has got a low platelet count. You can also ask for a repeat, that way to confirm that patient result. That can give you confidence that actually this is the actual platelet count result of that patient. So now there are conditions which can lead to a low platelet count. Okay, so there are conditions which can lead to low platelet count. It may not be from the sample, it may not be from the analytical, maybe platelet clumping and all of that. It could just be the patient condition, and that is why as well, when you see a low platelet count result, maybe one of the things you might need to consider even before checking the pre-analytical could actually be to check the patient condition. If the patient condition from the clinical detail, when you check the patient clinical detail and you see all kinds of conditions that suggest that this is why it is low platelet, then it can help you now to make a decision even without even going to check the pre-analytical. So let me give you some of the examples. You can have that disseminated intravascular coagulation. So this is now where there can be clotting in the system. Okay, what it means that clotting in the system will be chopping up a lot of platelets, and that's when you analyze the patient blood, you are going to see low platelet count. Okay, now it could be thrombotic thrombocytopenic purpura, which is TTP, and again this also is associated with clotting in the system, and of course which can also affect the platelet. Remember, the platelet help for blood clotting. So if there are clotting in the system, that it means that the platelet has been activated and they've been used up, and when you do the full blood count, you are going to see low platelet count. So TTP can also lead to that. Then you have ITP, which is immune thrombocytopenic purpura. Okay, what happens here is that maybe there is an antibody that has been developed that attack the platelet antigen, and once it attacks the platelet antigen, it can affect the overall platelet count of that very patient. Okay, now you have anemia, like I've already mentioned. If the person is bleeding, okay, or maybe hemolytic anemia or aplastic anemia, where the blood cells are not being produced the way it's supposed to be produced, that can also lead to the low platelet count result. Okay, now you can have treatment like chemotherapy. Like I've said, chemotherapy attack blood cells including platelets, and that could lead to a low platelet count, and this can be common in a case of leukemia. Then you can have infection like malaria, parasite, or viral or bacterial infection. Any of these very infections, even in pregnancy, can also affect platelet count result. Now, obviously, you cannot have a enlargement of the spleen. Remember that the spleen helps to regulate the blood cells, so it can take care of the old cells, okay, and kind of moderate it, control the amount of the white cells. So what it then means is that, or blood cells. So what it then means that sometimes it can be overreactive, and being overreactive, it can start chopping up, the cells, even when it should not remove it from the system. It may start removing it from the system due to its overreactive. So due to overreactivity of the spleen, because due to the enlarged spleen, that could make it to become overreactive and start removing a lot of platelets, okay, cells, and that way that can lead to low platelet count result. So yeah, thank you very much for listening. I hope I've been able to give you extensive explanation of what happened or what you are going to do in a case of low platelet count result. Now, what I want you to know is this. Another thing I've also forgot to mention is the fact that when you look at the blood film, you might see something like fibrin. So when you see something like fibrin is a kind of threading, is a thread. Okay, once you see it, it also suggests, even if you don't see clots from the sample, it suggests that the sample may be clotted. So you are better off asking them to repeat that very sample. Anyway, thank you for listening. I hope this helped you when you go for your interview to be able to put your answers in a way that may be appropriate. Remember, it doesn't have to take this long, that I've done it on this video. You just need to know how to be able to structure it and give your answers and give example where possible, and that way your answer will be comprehensive and detailed and sharp. Anyway, thank you all very much, and I wish you all the best till I come back your way again. Bye-bye.